The more I learn about COVID, the more I'm frightened by this virus and what it can do, especially to groups we're not thinking about. Hi, I'm Dr. Brian McDonough. As we're ramping up football season and as some stadium have 10,000 or 12,000 fans coming in, I worry about the college towns and the communities. I just know the way the virus works, and I know it's going to spread. There's no way it can't, and that bothers me. But a greater concern right now, in addition to that concern, is information we've learned about pregnancy and COVID. Now, we don't think a lot about pregnancy with this virus, but I bet if you're pregnant, you do. But here's the information we have thus far. There's been about 21,500 COVID positive tests in women who are pregnant. And in that group, 4,500 have been hospitalized, and 48 we know of have died. About 200 of them have gone to the ICU. So you don't really know who's going to have a worst case or why or what happens. So my advice is certainly if you want to have a family, you should have a family. And I don't think you need, because of COVID, to delay pregnancy. But what you need to do is be specifically very careful. Now listen, pregnancy is one of the healthiest states we have. As a person, you're probably never healthier than when you're pregnant. But anyone who's been pregnant knows everything in your body is to protect that baby. Basically, you're there for the purpose of having a healthy baby, the way nature works. So from a COVID standpoint, it is a good opportunity to attack someone as if they have a pre-existing condition, in this case, the pre-existing condition being the baby. So I have to strongly recommend, if you are someone who is pregnant or considering pregnancy, make sure that you protect yourself by wearing masks, respecting social distancing, and doing everything you can to protect yourself and your unborn baby. In the event you get sick or you think you are, you need to reach out to your obstetrician or family doctor, get help as soon as you can to make sure that this doesn't get ahead of you. The other thing is, and the CDC, thank goodness, has gone back to its original recommendation, if you're exposed to someone who is COVID positive and you're asymptomatic, get tested because you want to know. So right now, this is the information we have on pregnancy, and clearly I will give you more information as time goes on. Remember, we should be confident about what we know about COVID, but we can't be arrogant. Once we become arrogant, we make mistakes. We need to listen to the scientists. We need to make sure we take the information we have and we use it to protect ourselves, because we're just at the beginning of this battle and it's not going away soon. So make sure that you protect yourself. And if you're pregnant, please listen to this advice.